My name is Gloria Aykroyd, and I'm a social worker with the Infectious Diseases Care Program at St. Joseph's Hospital in London. There are people who are with our program, with the Infectious Diseases Care Program, who've been around almost since the beginning of time. I'm one of them. So when you've been around a long time, you remember the people from way back when. So there's that sense of history. There's a sense of understanding what they've been through, what the community's been through, what the community has lost, what the community has gained. I remember back in the early 90s when I first started at the clinic, it was not uncommon for our program to have 50 or more people die per year. And it was devastating, absolutely devastating. And the home was greatly used. Wonderful group of volunteers. I still think of June, who was one of the staff members there. And on Tuesdays, I'd walk in to go and visit people, and you would smell her stew or her cooking, and I'd go, June's here. Like, this is wonderful. It really was, which is why it was called A Home with Heart. I would remember going into the home to visit my clients. And I'd walk in that front door, and there was the big, beautiful window that had A Home with Heart written on it. You walked in the home and you thought, this home is filled with heart. The love you felt, the care, the compassion of the staff who were working there. And that to me just really exemplified a home with heart. You give someone shelter, you give someone good food, you give someone compassionate care, and it makes all the difference. The efforts of the home visiting teams from the AIDS Committee of London were doing absolutely wonderful work, but it was recognized that it was beyond what they could be doing, and the numbers were growing. So there had to be knowledgeable, kind, and compassionate people who are willing to take care. The group got together and determined, how can we provide 24-hour compassionate care to people who are living with HIV and dying from AIDS. It takes community partners to work together, if the client wants that to happen, to be able to help them and assist them. It is absolutely important. It may look different than back 25, 30 years ago, but it is still most important today. HIV looks very different today. There's the fear, there's the stigma, there's the discrimination today, but it's a little different than 25 and 30 years ago. Our hope one day is that there won't be any more HIV, but that's not where we're at today. And although the epidemic has changed over the years and people aren't necessarily dying as quickly, there's sometimes people do because they get diagnosed late, and they have, they're very, very sick. But there's still tremendous needs for people living with HIV. People need to feel that they're worthy, that they don't have to beg for things. They need to be able to have a quality of life that comes from saying, I've got enough food. Things that other people just take for granted. They just want to feel, I hear this a number of times, I just want to feel normal. I just want to be able to do things that other people do. They need to know that they can have a full life. They need to know that they can have a relationship. They feel that HIV is all of them. We try to help them realize, yes, it's in you, but it's part of you. And to help them realize they can have a full life. In terms of an actual cure for the virus, a medical cure, I hope that comes in my lifetime. We may not have a cure in my lifetime, but we can sure help to cure aching hearts. I couldn't imagine being anywhere else. The courage that I have seen in people coming through from time of diagnosis and walking on their journey and saying, please help me. It's been incredible. It's been very moving. It's had its ups, it's had its downs. But I can't imagine being anywhere else. I feel very strongly that out of all the illnesses that people can have, perhaps other than some very severe mental illnesses, I believe that this is the one where people face the most stigma and discrimination. And if I can be part of a healthcare team that accepts them for who they are and where they're at, and walk alongside with them to help them navigate their journey, I don't want to be anywhere else.